Hi, I'm Dr. Rahul Bharad. I welcome you all to my series What Life Has Taught Me Yesterday. Today when I'm recording this video is 21st of September 2023. I'll be talking what 20th of September has taught me in life. Yesterday I came across a situation where there was an emergency patient which I had to handle and the child needed admission immediately. I did all the examination, I counseled the parents and immediately asked them to get admitted, but somehow they refused for admission. Now, what are the factors which make parents feel hesitant and confused at the time of emergency, such as this case? I'll be discussing in this video, and probably that was the most important lesson I got from yesterday's life. What is that incident and how I'll try to learn something new from that incident, I'll be discussing in this video. If you haven't subscribed to my channel, please like, share and subscribe to my channel. Most important news I came across yesterday is about a very significant development as far as health facilities are concerned. Elon Musk company Neuralink, which is neurotechnology company being run and established by Elon Musk, has proposed to insert some microchips in the brain of those people who are having paralysis, and they are planning to do a human trial in that. They have got approval for that. The due approval, after getting that, they will be doing a research which will be almost 6 years, and probably in future we might see people having treated their paralysis with the help of brain computer interface, that is BCI. What is that news? I'll be discussing in this video. And most trending news I came across yesterday is about Women's Bill. Now we all know Women's Bill was long due to be passed from our parliament. Yesterday in Lok Sabha it has got passed against 554 votes against 2 votes. So most of the people have voted in favor of passing that bill. And what is the significance of that news, I'll be discussing in this video. So stay tuned till the end of the video to know more about all these details. Most important lesson I got from yesterday's incidents, I'll briefly discuss that incidents. One emergency patient was brought in emergency department. I examined the child. The child was referred from a periphery doctor who is sitting there almost 10-12 kilometers away from our hospital. The child was being done some test. Some test had revealed some significant problem in that child, and the child and the parents were counseled that they will require admission in a higher center like our hospital. So I examined that child immediately. Within 30 seconds of coming to the hospital, that child was in my cabin. I examined in emergency. I immediately took brief history from the parents while examining itself and immediately asked them to get admitted. In that also, even after giving so much prompt service also, parents were hesitant. Parents were in a kind of emergency and confused mind. Whenever I face such situations, a thought comes to my mind that if parents have been counseled by a doctor who is there from periphery and who had told them that child would be needing admission, why can't parents make their mind to admit the child? Now, when a doctor is referring a child for emergency admission, he is definitely sure that the child will require admission. When they come to another hospital, like referred to higher center, when they reach that higher center hospital, they are again into the same mind state whether to admit the child or not. Finally, the child I am talking about, they refused, the parents of that child refused the admission and they went back. Now, what are the lessons we all can get from such situations is that parents need to be very firm in their decisions. If the child is suffering, they have to decide whether they will be trying to get admit the child or not if the doctor tells them to do so. What happens commonly, many times parents say, sir, we are not in our mind, we are not prepared to admit the child. Now it is not about your mind preparation or doctor's mind preparation. It is all what is seen physically on the child. What are the problems baby is having, what are the problems blood investigations are saying or radiological investigations are saying, and that decides the admission of the child, and not what doctors think or not what patient relatives thinks. These are the basics of treatment of a child. That's what I just wanted to share with you all. Whenever a doctor tells parents to get admitted, their child get admitted, there must be some reason. You can definitely ask your doctor why the doctor thinks that the child needs admission. If you are convinced about doctor's explanation, you should definitely follow the doctor's advice, or at least ask them what are the consequences of not getting admitted. Because what happens, even after giving emergency services, within seconds of entry into the hospital and doing our examination and taking brief history, whenever we say the child needs admission, after that the parents will take minutes and hours together to decide whether the child needs admission or not. But when they enter into the hospital, they are in a rush, they are in a hurry. No, that should not happen. They should prepare their mind whenever a doctor is referring them to a higher center for admission. After reaching that hospital, the another hospital, they should be mentally prepared to admit the child. So that's what most important lesson I got, that hesitancy and confusion at the emergency will definitely cost children and not the doctor. That's what parents should keep in mind. Most important news I came across yesterday is about wonderful research by Neuralink company, which is established by Elon Musk. Now we all know Elon Musk is someone who does think very laterally and very differently from all the people across the globe. That's why probably he is one of the most richest people in the on the planet. His company Neuralink is trying to do a research where they will be implanting some microchips into the brain of the people who are having paralysis, either because of some neck injury or because of some diseases like amyotrophic lateral sclerosis, where paralysis is the main problem and patients are bedridden for years together. Now, what this chip will do, it will act as brain computer interface. With the help of this brain computer interface, these people would be able to use keyboards or laptops or desktop with the help of their thoughts. So just with the thoughts coming in their mind, they would be able to write some sentences, or they would be able to communicate with the whole world. So that would be a very significant part of the management of such conditions. They have got approval to implant those chips into the human brain. Earlier they have done it in some animal brain also, and have been successful in doing that. This would be a long study, probably 6 years that study would go on. After that, probably in a decade or so, we might see that these brain computer interfaces might be used in such cases. I'll be sharing link in the description box. Please go to the description box and click on the link, because that's very interesting and wonderful news I'm sharing here. Most trending news I came across yesterday is about Women's Bill. Women's Bill has been passed yesterday in India in Lok Sabha with the help of all the parliamentary members. It was passed with 454 votes against the 2 votes. Now 2 people, those who have voted against this bill, are probably Owaisi and Imtiaz Jalil. These 2 MPs have voted against. Apart from them, all of the MPs of Lok Sabha, they voted in favor of this women's bill. Rather, even opposition Congress leaders, they were asking for more reservations in this women's bill, such as OBC reservations and Muslim reservations, etc. But finally, after decades of struggle and after decades of thinking and overthinking about this bill, now 33% of the seats in the Lok Sabha and 33% of the seats in the state assembly would be reserved for women. This will definitely empower the women in our country. This will definitely give proper value to women of our country, and it will enable them to be a stronger person of this country, that will ultimately make their family, their district, their state a powerful one, and ultimately it will make India a very powerful nation in future. So that's very good step, I would say, all the members of the parliament have taken. It was the first bill which was tabled in the new building of parliament. We all know new building has started working, and the recent session which is going on, So this is the first bill of this new building, and what a wonderful thing it has been. So let's hope it helps all the countrymen to be a very responsible citizen, and it will help India to progress in their developments. For today, we'll stop here. Bye bye.